Shit. What's up, guys? Monday, day 4. Today I want to talk to you all about the fucking stigma of guys going and seeking professional help for mental health issues. I'm going to start off with my story, then lead into things I've dealt with such. So, start off, go back to when I was about 13 years old, got diagnosed with depression. Later on, got diagnosed with ADD, ADHD. It was still kind of new, coming out, whatever. I turned 17. I get my first diagnosis as being bipolar type 2. Go on medication. Stop that medication. Join the army. Get medically discharged from the army for being bipolar. My latest and most recent, and what I'm still technically diagnosed as, is rapid cycling type 1 bipolar disorder. Essentially all that means is my emotions go up and down a lot, very fast, very frequently, without any one particular thing causing them, and they just spike in both directions. Makes for a fun time. Not really, but at times it can be fun. I'm on medication. I've been on medication consistently for the past about 7 years, with maybe missing in the past 2 years. I'll occasionally miss like a day or 2 days max. Missing those 1 to 2 days of medication fucking sucks. It's awful. Feel like shit. Again, being bipolar, I pretty much just become a total wild card. Can either be very depressed, I can be numb, or I can be completely manic. Nobody knows. I don't even know what's ever gonna happen is gonna happen. The excitement, right? So, with all that being said, I've been to therapy before, quite a few times. I never actually liked therapy. Still don't like going to therapy. I don't go to therapy, and it's not because I have a problem with going. It's more I just don't like most therapists I've found. Best therapist I ever have found, Captain Thompson in South Korea. Dope as fuck guy. Best therapist I've ever had, by far. When it comes down to the stigma behind going and seeking professional help, if anybody thinks less of you for doing something better for yourself and treating an issue you're having in life, you owe it to yourself to have better people in your life and to not have them in your life. Like, that fucking simple. You don't deserve having people that think less of you for bettering or improving yourself or trying to fix issues. When it comes down to men don't talk about their emotions. One, most people that know me in real life know I don't really talk that much. I know it's kind of weird me creating YouTube videos now, and I'm actually talking. Still a little weird. Anywho, back to it. The point being, if you think you need medical help, if you think it would be a good idea to go talk to somebody, go fucking do that shit. Worth a shot. Try it. I mean, let's be real. If you piss and your dick burns, how fast are you going to the doctor? Same fucking story. Go get checked out. Make sure. See what's what. When it comes to being on medication, I struggled with this. I know a lot of people have struggled with this. When you get on medication, one, it's a long, bumpy ride. Just gonna be straight up hard facts. It'll throw you on curveballs, throw you through anything and everything. You'll hit a point, and that's just trying to figure out what medication is actually right for you. It is called the practice of medicine. Psychiatric care is still relatively new in the grand scheme of medicine. So it's really hit or miss on how the meds are going to actually affect you. It's scary, but go through it, persevere. You got this. Secondly, once you do have it, you're starting to feel better, don't stop that shit. I'll tell you right now. Worst thing to do is you start, and I've done this probably more than 10 times. I start to feel better. I'm like, hey, I don't need my meds anymore. Stop taking my medicine because I don't like being on medicine. I don't like the stigma of being on medicine. But I mean, it's okay to be on medicine. So when you do start feeling better, don't stop taking your meds. Nowadays, for me, I'm on 3 different medications. I've been on them for a while. I have to go get blood work done every once in a while for the medications I'm on, just to make sure all my levels are okay. And it's pretty much just part of my day-to-day life. It becomes routine. Don't really think anything else much of it. It just is what it is. I know I need to take them, and so I take them. And it allows me to function properly and safely in society and keep my ass from being dead or in jail. So props to those fuckers. That's it.